Case study number 4. Summary. Linda Brown, a 65-year-old female. Linda presents with shortness of breath, fatigue, and swelling in her legs. She has a history of congestive heart failure (CHF). Current situation. Linda arrives at the clinic with worsening shortness of breath, fatigue, and bilateral leg swelling. Her vital signs are blood pressure 145/90ths of a millimeter of mercury, heart rate 110 bpm, respiratory rate 24 breaths per minute, temperature 37.2 degrees Celsius 98.9 degrees Fahrenheit, oxygen saturation 94%. Questions. Question 1. What are the potential diagnoses and pathophysiology for this patient? Answer A. Exacerbation of congestive heart failure (CHF). CHF is characterized by the heart's inability to pump effectively, leading to fluid buildup in the lungs and extremities. Pathophysiology involves decreased cardiac output, increased systemic vascular resistance, and fluid retention. Key points include managing fluid balance and improving cardiac function. Answer B. Chronic obstructive pulmonary disease (COPD) exacerbation. COPD exacerbations can cause shortness of breath and fatigue due to airway inflammation and obstruction. Pathophysiology includes chronic bronchitis and emphysema, resulting in impaired gas exchange. Management focuses on relieving airway obstruction and reducing inflammation. Question 2. What immediate nursing care is required for this patient? Answer A. For exacerbation of congestive heart failure (CHF), administer diuretics as prescribed to reduce fluid overload. Monitor vital signs, especially respiratory status and oxygen saturation. Position the patient in a semi-Fowler's position to ease breathing. Educate the patient on fluid restriction and low-sodium diet. Answer B. For COPD exacerbation, administer bronchodilators and corticosteroids as prescribed to reduce airway inflammation and improve breathing. Monitor respiratory status and oxygen saturation. Encourage effective coughing and deep breathing exercises. Educate the patient on smoking cessation and proper use of inhalers. Question 3. What diagnostic tests and treatments are necessary for this patient? Answer. Chest X-ray to assess for pulmonary edema or other lung pathology. Echocardiogram to evaluate cardiac function and identify any structural abnormalities. B-type natriuretic peptide (BNP) test to assess the severity of heart failure. Arterial blood gas (ABG) analysis to evaluate gas exchange and acid-base balance. Electrolyte panel to monitor for electrolyte imbalances due to diuretic therapy. Medication information. Diuretics, for example, furosemide. To reduce fluid overload and decrease symptoms of CHF. Considerations: monitor for signs of dehydration and electrolyte imbalances. Educate the importance of taking diuretics as prescribed and following a low-sodium diet. Side effects: hypokalemia, dehydration, hypotension. Contraindications: severe electrolyte depletion, anuria. ACE inhibitors, for example, lisinopril. To decrease blood pressure and reduce the workload on the heart. Considerations: monitor blood pressure and renal function. Side effects: cough, hyperkalemia, renal impairment. Contraindications: history of angioedema related to previous ACE inhibitor treatment. Bronchodilators, for example, albuterol. To relieve bronchospasm and improve airflow in COPD. Considerations: monitor respiratory status and educate the patient on proper inhaler technique. Side effects: tremors, tachycardia, palpitations. Contraindications: hypersensitivity to the drug. Corticosteroids, for example, prednisone. To reduce inflammation and COPD exacerbation. Considerations: monitor for signs of infection and educate the patient on the importance of following the prescribed tapering schedule. Side effects: hyperglycemia, increased risk of infection, osteoporosis. Contraindications: systemic fungal infection, Lyme virus.